Today we're here to launch our overdose and naloxone prevention program. We're the first agency in Hawaii to release this. So on July 7th, Governor Ige signed Act 68, which increases access to naloxone in our community. And naloxone is an opioid antagonist that restores breathing for people that stop breathing because of an opioid overdose. An overdose is the leading cause of injury-related death in Hawaii, which is why we're here today. So what we're doing is educating folks about overdose. They come and talk story over here, like you see. People will be asked questions about their risk for overdose, educated about what happens when people are overdosing so that they can recognize an opioid overdose. Then they'll be taught about naloxone, which is a very safe medication approved by the FDA to respond and help people live through an opioid overdose. We ask questions, and we will be actually showing them how to use this medication. You draw it up into a syringe, and then it goes right into the muscle, the deltoid in the arm or in the thigh. If someone doesn't respond in about 2 minutes, then we give them a second dose to do that again. And then they may do rescue breathing until the first responders arrive. Over 10,000 people have been saved on the continent from this little medication, and now Hawaii will be the 38th state to join. To our data, about half of our participants have witnessed an overdose in the past couple of years. So by our participants, the CHOW Project runs the statewide syringe exchange. So we're working with people that use needles to inject a wide variety of substances. The majority of the drugs that our folks use are opioids, and so you can imagine our folks are at high risk for overdose. But honestly, anybody who uses opioids could be at high risk. If you ever have a point of abstinence and then you use again, let's say you go into recovery and then relapse, you're at risk. If you've been inside incarceration or otherwise stopped and then used again, you're at risk. If you use multi-drugs like alcohol or other prescription drugs, you're also at risk. So we're targeting those most at risk for overdose. We're also really thankful in our collaboration with the University of Hawai'i and Dr. Tricia Wright, who is our collaborating physician, signing our standing orders that allows us to distribute and train folks today about naloxone.
And I think overdose prevention is so important in the whole spectrum of care for persons with addiction, and our opioid epidemic throughout the country is overwhelming. We have lost so many important people to overdose. You know, Prince, Philip Seymour Hoffman, Corey Monte, and our own Andy Irons. So this just goes to show that addiction affects all walks of life. It's not just the stereotypical people that we think of, and we really need to destigmatize addiction in general and get life-saving treatments out there. So I'm very excited for this project. I'm very excited that Hawaii has joined the list of states that provide this. As a physician, my whole entire goal is to maintain quality of life and prevent long-term illness and death in this case. Overdose deaths are leading the accidental deaths in Hawaii, just like the rest of the country. It leads motor vehicle accidents, so it's a very important problem. We're not immune, even though we don't have perhaps as much heroin here as the rest of the country, we are not immune.